Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Hi, and welcome back, boys and girls. And I say that because tonight's episode of Healthy Living with our good friend Dr. Jitka Lom, who will be here in just a couple of seconds, is something that you are going to like, because tonight we are talking about piercings and tattoos. They used to be something that only typically like people in the Navy would get, when they go overseas, and basically as a symbol of your masculinity or your toughness. Now basically everybody gets them, and many people say they're a form of art, they're a form of expression, and they're a form of letting people know who you are in the world. That's totally cool. So here is the good doctor.
Hi, Jason.
Welcome back. Okay, so your role as a healthcare practitioner, of course, you're a general physician and a family physician, so you see a lot of people that come in. I'm sure you've seen your share of body piercings and tattoos and everything like that. But I want to talk about what healthcare afflictions are possible, because obviously, you could get infected, and people are getting pierced everywhere these days. And some of them are very creative.
Yes, yeah, they can be really beautiful, but you really have to think, a little bit long term, because I do often see tattoos and piercings that need to be removed because the people want to join the military or want to have some other job where, their uniform requires them to have bare arms, for example, and so they come in for tattoo removal. The piercings, kind of similar. Sometimes they can get infected or painful. And one common thing that will happen here on Guam is that people can develop keloid scars from body piercings, and those are thickened, very, very tough, large swellings that you can get after any kind of injury to, for example, the earlobe or on the chest or other parts of your body.
Now, how about piercings on certain parts of the body? Like you said, they're covered up because they're like a lot of young women get them, and I'm not going to say the word they used for it,
right?
But it rhymes with stamp.
Yeah.
And they get it like in the lower back.
Right.
But because of Guam's climate and humidity and everything, the fact that it's covered up and everything, does that increase the chances for infection? Or?
Typically, the tattoo parlors actually have a pretty good sanitation procedure.
They're very professional.
And
yes.
They are. But of course, if you go in the ocean right after you have your tattoo placed, or you don't take good care of it, it could get infected. Another thing that can happen is you can actually have an allergic reaction to the type of dye. And dyes that are used in tattoo ink really vary. They're across the map. They're not FDA regulated. And so you want to go to a good parlor and inquire first about what kind of inks they're using and find out if they're removable later. Should you change your mind, some tattoos can be laser removed and some types of ink cannot be removed. And so you want to know that it's a vegetable dye that can be removed later. You also would like to stay away from the metallic dyes, especially cadmium, nickel, these type of metal dyes, because the metal can react with your skin and you can develop what's called a contact dermatitis, which is basically a rash that will not go away until all of the ink is gone, and that may take a few years before you finally get rid of it. So to prevent sensitivity and problems, choose vegetable dyes that do not have any of those metals in them.
Well, you just gave me some food for thought. How about if someone is a hemophiliac? And we do want to stress that you should go, as the good doctor said, to a professional parlor, because they are very, very good. They're masters at their craft.
Yes.
They do wonderful art, and they're really good, and they have tools, and they're all sanitary.
Yes.
But how about if someone does have hemophilia? Do they have to disclose that? I would think so.
Oh, yes. Or if they have, hepatitis or HIV or any kind of, blood-borne disease, of course they should mention that to the tattoo artist. The tattoo artist should be wearing gloves. And, then there's the home tattoos that the kids do using ballpoint ink, pen ink, or, other inks that they may have, marker ink, and they put their initials and whatever else on their hands. Don't do that. Use the temporary tattoos if you really want to do that, because down the road, it's for sure something you're going to regret.
Now let's talk about body piercings. And before, it used to be that even getting a earring, if you weren't a girl above 16 years old, was considered risque.
Yeah.
But now, like you said, it's an art statement. It can be very beautiful. It's a symbol of jewelry on men and women. But typically, they would only get in the earlobe because that's a very fatty part of the body, and maybe with cartilage in the other parts.
Yeah.
How about now? Because people are getting them in their eylids and their lips and
all over
their navels.
On the ear, if you get piercings down here on the pinna, that's the soft earlobe part, those tend to be okay. Up higher, you have a much higher chance of infection. As you mentioned, the cartilage doesn't have such a great blood supply, so healing isn't as great. Of course, if you're diabetic, you probably don't want to do that. And you need to take good care of the piercings afterwards. So often they'll get infected. You want to wash them with soap and water. You do not need to use peroxide or alcohol or any other type of thing. Just soap and water a couple times a day after you've had your piercing done. And as far as other places like the tongue and the eye and nose and these other areas, again, you want to keep them really, really clean. Tongue piercings can go along with gum infections. Rarely, if somebody doesn't have very clean teeth and they get piercings inside their mouth, even on their lip, they can cause an infection that actually goes into their bloodstream.
Because it's an exposed wound.
It is. It's a wound inside their mouth, and that'll pick up bacteria from their teeth, and that'll travel through and actually settle on their heart and cause a nasty heart infection. So yeah, maybe get your teeth clean first before you go for tongue piercings.
So we're not discouraging the fact that you want to express yourself or be artistic and everything. Just be smart about it and do it right and get it done with a professional.
And as much as possible, do things that are reversible. So if you're going to do ear piercing, think about it carefully. Choose to do it in your earlobe. Those generally will close up over time, whereas if you do it up at top, it probably will never close up. If you're somebody who forms keloids, skip the piercings. You're going to get a keloid. It's going to be a nasty, ugly scar. They can't be cut out very easily, and you'll regret it. So whatever you do, you want to make it something that you might not regret later.
Okay, well, this is a fascinating topic, and we have so much more to come. So sit tight, and you sit tight out there in TV land, because Dr. Lom will be right back, and we'll take your viewer questions, what you sent us on Facebook right after this on tattoos and piercings right here on Healthy Living Tuesday.